Health conditions prevalent in the tropics, Part 10. What is tuberculosis, TB? Tuberculosis is a potentially serious infectious disease primarily caused by the bacterium Mycobacterium tuberculosis. It mainly affects the lungs, pulmonary TB, but it can also affect other parts of the body such as the brain, kidneys, and spine, extrapulmonary TB. TB spreads from person to person through the air when someone with active pulmonary TB coughs, sneezes, or speaks. Transmission. TB is transmitted through airborne particles released when a person with active pulmonary TB coughs, sneezes, laughs, or talks. Unlike the common cold or flu, TB is not spread through surface contact, sharing utensils, or physical touch. Prolonged and close contact is typically required for transmission to occur. Incubation period. The incubation period for TB, the time from exposure to development of disease, can vary widely. It generally ranges from 2 to 12 weeks for latent TB infection to develop after exposure. However, a person can remain asymptomatic with latent TB for months or even years before developing active TB, particularly if their immune system becomes weakened. Signs and symptoms. The symptoms of active pulmonary TB develop gradually and include persistent cough lasting more than 3 weeks, coughing up blood or sputum, night sweats, fever and chills, unexplained weight loss, fatigue and weakness, chest pain, especially during breathing or coughing. Extrapulmonary TB symptoms vary depending on the organ involved. Diagnosis. TB is diagnosed using a combination of clinical evaluation, laboratory testing, and imaging. Sputum smear microscopy and culture are traditional diagnostic tools. Chest X-rays can help identify pulmonary TB. Molecular tests like GeneXpert MTB/RF provide rapid detection and drug resistance profiling. Tuberculin skin test, TST, and interferon gamma release assays, IgRAs, are used for latent TB screening. Severity and complications. If left untreated, TB can become life-threatening. It may lead to widespread damage in the lungs, respiratory failure, or disseminated disease affecting multiple organs. Common complications include hemoptysis, coughing up blood, pleural effusion, and TB meningitis. In people with weakened immune systems, TB can spread rapidly and cause severe disease. Drug-resistant TB forms are much harder to treat and come with higher risks of complications and mortality. Prevention. TB prevention focuses on both individual and community-level interventions. Key strategies include BCG vaccination, Bacillus calmette, Garin, especially for children in TB endemic countries. Infection control measures in healthcare settings. Preventive therapy for latent TB infection, especially in high-risk groups like people with HIV or those in close contact with active TB cases. Improved ventilation and hygiene in crowded settings to reduce airborne transmission. Treatment. TB is treated with a standard course of antibiotics taken over a period of at least 6 months. The first-line drugs include isoniazid, rifampin, ethambutol, and pyrazinamide. It's essential that patients complete the entire treatment to prevent relapse and the development of drug resistance. MDR-B requires longer treatment with second-line drugs, which may be more toxic and less effective. Directly observed therapy, DOT, is often used to ensure adherence. Global significance. TB remains one of the top 10 causes of death globally and the leading cause of death from a single infectious agent, surpassing even HIV/AIDS. Despite being a preventable and curable disease, millions of people continue to fall ill every year. Low- and middle-income countries bear the greatest burden, with Asia and Africa accounting for the majority of TB cases. The World Health Organization, WHO, considers TB a global health emergency, especially in the context of drug-resistant forms. Public health impact. TB poses a major threat to public health due to its high transmission potential and long treatment course. It often affects the economically productive age group, 15 to 49 years, leading to lost income and productivity. The rise of multi-drug-resistant TB, MDR-B, and extensively drug-resistant TB, XDR-B, further complicates treatment and control efforts. TB is also closely linked with HIV, and co-infection is common in areas with high HIV prevalence, compounding its public health impact. Where is it found? TB is found worldwide, but the highest burden is in developing countries, especially in parts of sub-Saharan Africa, Southeast Asia, and the Western Pacific. Countries like India, Indonesia, China, the Philippines, Pakistan, Nigeria, and South Africa have some of the highest case numbers. TB can also persist in marginalized populations in developed countries, particularly among immigrants, the homeless, and people with HIV.